Hello again, and welcome to Billing 201 for Behavioral Healthcare, the Echo Group's webinar series taking a deeper dive into billing topics and issues related to behavioral healthcare. Today is part one of our four-part series, You Don't Know What You Don't Know. We're going to take a look at the KPIs, or key performance indicators, that are specific to behavioral healthcare. What are they, and what they mean to you and your organization, and how you can get the most from them. Today's agenda will cover a lot of ground over the course of the next 30 minutes. We'll talk a little bit about Echo, and then we'll get Scott Taylor, our presenter, in as quickly as possible to start drilling down into the content or the purpose of our webinar today. A little bit about the Echo Group. We've been privately owned since 1981 by the same ownership group. We're located in Conway, New Hampshire, in beautiful New England. We currently have partners and customers in over 35 states, and we offer integrated clinical and billing software and services. We've been offering revenue cycle or billing services since 2001, and currently each and every one of our revenue cycle optimization partners have realized improved billing performance. So we thought we would take the information that we've learned from those experiences and share it with you. For those of you on the line who are current Echo partners, just a reminder that our peer-to-peer annual summit is this fall, this October, in beautiful Portsmouth, New Hampshire. So we will release the agenda later this week, meaning tomorrow, so you can register. For those of you who aren't Echo customers and are looking for some incentive to maybe become one, this would be a great thing to take into consideration. It's a fantastic annual event that we host with our customers. In case you missed it, the current series, Billing 201 for Behavioral Healthcare, is the second series that follows up our Billing 101 series that was really a fundamental overview of billing for behavioral health care. We've recorded and documented all four parts of that series, and that webinar series is available on demand. When I follow up with you folks after this session tomorrow or the first part of next week, I'll also include a link with access to the recordings and slides for the previous webinar series, so that you can take a look at that and then get caught up with regard to what we're working on here. Now to introduce today's presenter. Scott Taylor is a sales director for serving the Southeast region, but he's been with the Echo Group now since 1996. He has done a little bit of everything with the Echo Group. He's worked in professional services, support, in any number of areas. So he knows our organization and our industry inside and out. He's a recognized expert and thought leader in our industry, and he was a natural fit to lead off the first part of the Billing 201 webinar series. So without further ado, I'm going to turn things over to Scott. Before we do that, it just occurred to me, a little housekeeping. If you have questions along the way, you should see in the webinar on your screen a little box where you can enter questions. Feel free to ask questions at any time. We'll compile them, and we will get to as many of those questions as time allows. Now, without further ado, Scott Taylor.
Good afternoon. I'm Scott Taylor, the Director of Sales for the Echo Group in the Southeast. This afternoon, I'll be talking about how you can use key performance indicators, or KPIs as they are often called, to measure and contribute to the success of your billing and accounts receivable functions. It's important to note that unlike runs batted in, or RBI, in baseball, which are inherently plural, multiple KPI are KPIs. And I promise this is the only sports reference I'm going to make this afternoon. Choosing KPIs carefully and setting benchmarks for billing performance can help inform financial decisions in your organizations. KPIs for billing and accounting tend to have three important characteristics. First, they look at information over time to help you see trends in your organization and in your performance. Secondly, they usually include goals based on either internal financial requirements or industry-wide measurements that you can use as benchmarks. And finally, the information in KPIs informs your process improvement and suggests other data that you may want to measure to be able to look at that in a more granular fashion and understand what in your process is contributing to the results your organization gets. So this slide shows a common chart uses a basic measure of billing performance. We can see it shows how much was billed on a month-by-month basis. This type of display makes it easy for you to see trends, and obviously we're billing less each month since October. The red line represents that benchmark that we want to see, and that's our monthly billing goal. We could also have a straight trend line in this display that would show us whether we are level, improving, or decreasing our achievement of those goals. Based on the performance in this chart, we want to start exploring reasons why we're billing less each month. So some of the things we might want to explore: what is the relationship between what we're billing and what we collect? Is there a concomitant reduction in the number of services being billed? And are we charging more or less for each of those services? When we overlay the total collected by month, we can see there's a pretty close relationship between what we bill and what we collect. That stays pretty steady. This chart matches the collection amount to the billing month. So as we look at those months, the collection amount is the collection amount that was collected in the month of the service date, not the time that it took to collect that money. We could also compare that total billed and total collected by looking at it in the collected amount, and we would probably see a shift in that total collected. So again, we have a fairly close relationship between those numbers. The next chart shows the total amount billed and the number of client hours, and you can see they closely resemble one another. There are exceptions in July and October. We see a spike in the amount billed, despite less pronounced increases in the number of clients billed. So you can see we billed over $40,000 more for July services than we did for June services. However, we only provided about 50 more hours of service. So again, having this kind of information available to us lets us see, is there a correlation between those? We're actually headed to the dollars per client hour. This is the one we wanted to look at. Total client hours, I'm sorry. So you can see in July, we did bill about $40,000 more, but we only increased our number of services by a small amount. Going now to our total billed per dollar total client hour, for dollars per client hour. This compares the total dollars billed each month to the number of dollars billed per client hour. And it can be useful in understanding what drives that raw number of hours billed. It will show you if more or less high-value service is being billed, and it's independent of the number of hours that are being billed. So changes in service mix and reimbursement rate may drive these dollars per client hour. And again, analyzing this further by program, staff, location, or funder can help provide insights to where the highest reimbursement comes from and how that drives the total amount billed. Moving ahead to some of the other industry standard metrics that are commonly used. The first of these is days in AR. Days in AR is a calculation that's designed to help you understand how quickly you're collecting money for the services you provide. And it is calculated over a finite period of time, usually 6 months, could be a year, it could be 90 days. And again, it may be appropriate to track those days in AR on a month-over-month basis so you can see those trends. The calculation is shown here. First, we calculate your average daily charges for the period, and we do that by summing all the charges for the period. And then we divide that by the number of days in the last 6 months, and that will give us the average daily charge. Next, we calculate the total accounts receivable at the end of the period. So we find how much do we still have outstanding, and then we divide it by those average daily charges, and that will give us our days in AR. And here are some general benchmarks for you to look at. If your days in AR is below 40, that is good performance, a very good performance. 40 to 50 days is average, and you should be concerned if you're starting to see that your days in AR exceeds 50. This tells you that you need to step up your collection efforts and start looking more closely at denial reasons and perhaps looking at more upstream checks to make sure that all of your services that are going out are clean claims. This next metric is the percent of AR over 120 days. And the intention here is to help you understand how much of your billed charges have aged. And once charges are outstanding for over 4 months, the likelihood of your being able to collect those drops fairly dramatically. So monitoring this can help you avoid future cash flow problems. And again, the calculation is a comparison of 2 simple variables: the total amount of AR that is over 120 days right now, divided by your total AR. And then you can multiply that by 100 to represent it as a percentage if you'd like. And again, in terms of industry comparisons, if you're under 15%, that's very good performance. 15 to 18% is average. And once you get over 18%, you should be concerned about your ability to collect those funds and what effect that's going to have on your cash flow. Adjusted or net collection rate is a measure how much you collect after adjustments for amounts paid by other and for contractual adjustments. So here we simply select your credits from the total payments that you've received and divide that number by the sum of your charges less your contractual adjustments. So here we're not looking at the total amount that's on the bill, but we're looking at any contractual adjustments that you have, either because you have entered into a contract with a commercial pay source, or the difference between your usual and customary charge that you bill and the maximum allowable benefit for your Medicaid or state funded system. And again, from a performance standpoint, we can multiply that by 100 to again render that as a percentage. And here, adjusted net collection rates greater than 99%. What we're looking for, 95 to 99% is in the normal range of industry average. And then below 95%, you want to start looking at your processes. The claims denial rate is a simple calculation of how much, the total claims that have been denied divided by the total claims submitted. And if we look at the rates, again, we want those to be less than 5% for excellent performance, and then 5 to 10% would be industry average. If it's over 10%, that's higher than we want it to be. Average reimbursement rate, and this is how you would determine how much your organization has collected from the claims it's submitted. And again, this one is also most useful when tracked longitudinally, so if you can see whether you're trending toward higher or lower reimbursement rates. You would calculate this by determining the sum of your total payments and dividing that by the sum of your total claims. And this provides a ratio that, again, can be multiplied by 100% as a percentage. And we would look for a positive trend over time. And in the 35 to 40% ranges is good. But usually here we're looking at trends, whether that's trending up, trending flat, or trending down. And then further filtering these by staff, program, location, or funder to provide more granularity about where those reimbursement rates are increasing or decreasing. And is that happening because of the number of services that are being provided, the value of the services that are being provided? It also can be affected by changes in reimbursement rate and a shift in program emphasis. So we've talked about a number of ways to quantify the accounts receivable of your organizations. And these KPIs can help your organization understand whether trends over time, how you compare to industry norms, and what corrections you should start looking at to improve your performance.
Thanks, Scott, for walking us through those KPIs. Right now, we'd like to open it up for questions. And again, just type your question in the box that you have on your screen, and we'll be able to address as many as we can. We have our first question that came in. Scott, you referenced the term AR frequently. Can you just clarify, what does AR mean?
AR is accounts receivable, and that's the monies that are owed to your organization for the services you have provided.
Another question that's come in. So as you went through and calculated the different KPI, specifically submitting clean claims, and you indicated that the higher percentage of your claims that go through and are paid first time through, the better your performance. Why is it important if a claim is paid first time through as opposed to maybe having to resubmit it 2 or 3 times, as long as you're getting paid?
Well, the timeliness of these payments is important. With most electronic billing systems today, many funders are able to reimburse you in 7 days for a claim, so you get your money much quicker and can use that to pay staff and provide more services. If you pass a claim through and it gets into adjudication with your payer, the process for making those corrections, for tracking down exactly what the reasons for denial are, can take more time and prevent that reimbursement. You may also have circumstances where you have a secondary payer that has a short, timely filing window. So if you do not get that response from your primary funder in a timely fashion, you may be at jeopardy of losing money on those claims. So those are a few of the reasons why we want to measure that.
Okay. Another question in. Do you work with health and behavior codes or just straight psychological CPT codes?
We work with both CPT codes, sick pick codes, and local codes that are being used by state funders and Medicaid systems. So we work the entire variety of those.
And by we, I'm assuming she was asking about our electronic health record.
Yes, the electronic health record, our customers in the variety of states that we work with, and also our revenue cycle optimization team internally who bills for behavioral health care organizations.
Scott, as you walk through the KPI that was that you shared a couple of numbers that you track that are related to clinician hours and client hours with regard to the amount of money. Why is it important, again, to track the amount of hours and the amount of money that's received for your clinicians or the amount of time you spent with clients, as long as you're getting paid?
Well, I think the relationship among those numbers is important. If you're spending a lot more hours, clinician hours, and getting less reimbursement, it may be worthwhile to look at a number of different factors. What are your reimbursement sources? Is it specific to certain programs? Is it certain staff? So that's certainly one reason. The number of the dollars per client hour is another piece of information that can be important in understanding where the largest reimbursement amounts come in. If you are working in multiple states or working with multiple funders or have programs in different areas, those reimbursement rates may be very different, and understanding where to focus on those gives you insight into what's going to provide the most dollars to be able to fund your mission.
Okay, and we have a follow-up to the codes question. Have we seen the FQHCs use the H and B codes?
That I'm not personally familiar with. We can provide an answer to that, and we post that on our website, Chris, as part of this. The Q&A is going to be on the website.
We will include the Q&As in the when we share the slide presentation. Yes.
Okay. So we will answer that one. We'll get the appropriate person to answer that question.
So, Scott, again, in a relatively short amount of time, you covered a lot of ground with regard to KPIs related mostly to billing revenue and trying to track that information. For anyone who doesn't track or is not keeping up with this sort of data or using this data, what's a good place to start? If you had to rank the KPI, where would you start, and what's a good path with regard to putting together first a simple and then expanding your KPI tracking process?
The number of days in AR and collection rate are probably the two most important things to be aware of. And again, how do you compare to the industry standard? And what is the trend? Are you doing a better job, or are you not doing a better job? The other thing that you should be aware of is if you cannot calculate your days of AR, or you cannot calculate your collection rates based on the data that you have, that's something that you would need to address as well.
And what are circumstances or situations that would make it not possible to collect that data so you can make those calculations?
There are many. It could be configuration of your electronic health record. It could be the type of health record that you have. It could be that you do not have a health record, electronic health record, or practice management system at all. So there are a number of different factors that could contribute to that. Those will be the most common.
Okay, we've got time for another question or two. Scott, one last question. When we were looking at I think it was the net collection rate, one of the last KPI there, you were referencing being able to review the data not only on the whole, but also by specific areas within your organization, whether it's your clinicians, your program, your clients, et cetera. Why would we want to know that information by those particular areas as opposed to just tracking it on the whole?
Well, those are decisions I think behavioral health organizations and most organizations make on a very regular basis. We want to know how many people we're serving in different programs. We want to know, obviously, the cost of serving those individuals, and where are we getting the most reimbursement for our effort, for our investment. Combining that with some kind of clinical outcomes is a very common way of making decisions about how you're going to promote your mission most effectively. So a combination of what kind of outcomes do we get, and how much are we getting reimbursed, and how much does it cost us to do that, is really what most organizations are doing.
All right, Scott, that's about all the time we have with regard to questions and information. Scott, thank you very much for walking us through and taking a deeper dive into key performance indicators as it relates to behavioral health care. Thank you, folks, for tuning in and registering. Just so you know, over the next couple of days, the first part of next week, maybe after the holiday, we will send information out so that you can access a recording of this webinar and also access the slides. We'll have follow-up, we'll have answers to some of the questions that were asked, and also information to access the recordings of the Billing 101 webinar series and those slides as well. In the meantime, you've already registered for the webinar series, so we'll be back in 2 weeks on July 13th with part 2 of our Billing 201 series for behavioral health. And in that episode, our senior knowledge expert, Suki Norris, will walk through a comparison and contrast of the electronic billing process versus paper billing. So until then, have a great holiday weekend, everyone, and thanks for joining us.